Hello friends, I am posting this video after more than 1 year regarding the problem of anxiety neurosis. In the first part of the video, I had tried to explain to you as to what anxiety neurosis is, what are the symptoms, and how to really cope with it, and what are the remedies. So it was basically an introductory video which was based on my experiences with anxiety neurosis. It was first hand, and therefore I had told you all the things which happened to me and how I coped with it. Now, then, in the last video, I had told you that I'm undergoing treatment for anxiety neurosis. Uh, Now, it's more than 1 year that my treatment is continuing, and I will update about the improvement which I had in the course of the treatment, and after 1 year, how I feel, what are the symptoms, whether they have gone or not, how I have coped with it, whether there were any new problems coming up. So, all these things I'm going to discuss in this short video. Firstly, the treatment which I had undergone, or should I say I'm undergoing for the last 1 year, has really helped me a lot. Very frankly, I'm telling you. It has, to a large extent, controlled my symptoms. Uh, I would really say that the symptoms have improved by at least 80%, and the medicines, thankfully, in my case, have not really produced any significant side effects, so they have suited me well. Uh, Now, talk about what improvements I have in the last 1 year. Previously, in the last video, I told you that I used to get uh, anxious about very small things, about routine things, and for no apparent reason, I used to be nervous. I was not able to do my daily activities. It was affecting me a lot. There were palpitations, there were things like, not in a frame of mind to do anything positive, getting up in the morning and feeling very low, and really getting anxious and nervous about as to how I will spend my day, how I'll complete my daily work. So those things which I have been doing for years and years, I was not able to really handle them anymore, and I was very nervous about those very things which are very normal, which we do every day. I consulted a doctor, and I would advise every one of you to really consult a doctor and don't shy away from telling your symptoms, telling your problems to a qualified doctor, because that's a must. Because if you think that this thing can be wished away, anxiety really can go away on its own, if it doesn't for a few weeks, then you must consult a professional. Things like yoga, it helps. Things like spiritualism, it helps. But if the symptoms are not improving to that extent where you feel that you are normal now, or you are on the path to normalcy, then you must consult a doctor at the earliest. Now, coming back to my case, these symptoms of nervousness, first thing in the morning, which I used to feel, now they have gone, almost they've gone now, I would say, almost. Now, when I get up in the morning, I feel positive, I'm happy, I'm feeling that I have to do so many things in the day. I'm back to my older self to a large extent. Although I must admit that I am a bit of a nervous temperament type of a person, but I was never that nervous as I was last year when the symptoms were at its peak. That was abnormal. Certain nervousness is there in everyone, but the abnormality of the symptoms have now really come down drastically, and it is now more or less within control. As I've talked in the last video also, that when you are not able to handle nervousness and anxiety on your own, with your own willpower, with your own management skills, which each one of us has, then you must consult a professional, because that is the time when it is affecting you in a way which can really be detrimental to your health, both mental and physical. So, in my case, when I get up in the morning now, I feel positive, I'm happy, I really feel that I have to really do so many things in the day, and people around me can feel it. And in the course of the day, the routine things which I used to do before the onset of anxiety, neurosis in my case, now I'm doing those routine things in a very calm and cool manner, as we all should be doing. My day to day activities are very much normal. The only nervousness which is left a little bit is more or less which is there in every human being. It's now not really having any sort of effect on my mental and physical well-being. So that is the number one improvement, is that anxiety and nervousness has gone down considerably. The symptoms have improved drastically. Now, number two, I think when we consult a doctor and we start taking medicines, we are always apprehensive about the fact that what will be the side effects, because as we all know that most of the allopathic medicines have got some side effects. There's no allopathic medicine which is without side effects. It's just that some side effects are visible in some people and some are visible in some people, and there may be some people who may not have any side effects at all. So in my case, luckily I would say that the prescribed medicines did not produce any significant side effect on me, and that was really a very very important start as far as my treatment was concerned, because without managing the side effects, you can really be having trouble with your treatment. In my case, there was absolutely almost no side effect. So that really helped me a lot. One more thing which you must remember is that when the treatment starts, and if you encounter any side effects, then do tell the doctor at the earliest. Although a good doctor will always tell you that there may be some side effects, and you come back to me when you feel any of those side effects. He will list out a few prominent side effects. And if you feel them, then you may consult the doctor. In most cases, the doctors, if the side effects are not very significant, doctors advise you to continue the treatment so as to make sure that your body gets used to the new medicine which you are taking. And once the body gets used to it, the side effects will automatically go away. That will be in a few days, a few weeks' time. So you need to tell the doctor about whatever you are feeling after taking the medicines. So that is very important when you start treatment, especially treatment related to anxiety, neurosis, or depression, or such things. Number three, in my case, another good thing which happened was that the improvement was very, very fast. Actually, whatever I had read about that particular medicine which was prescribed, in today's case, whichever medicine doctor prescribes you, you can Google and you can come to know about the whole medicine and its side effects, and what is its action, how the medicine pans out in the course of treatment. So in my case, the medicines which were prescribed to me were supposed to really work a bit on the slower side, but in my case it worked very fast. Within, I think, 3 to 4 weeks, the improvement was, I would say, it was clearly visible. I could feel it, and it continued. And for the last 1 year, I'm now still under treatment, and the doctor advised me to continue taking the medicines for some more time in the same configuration, same potency. He has not reduced the medicine or in any way, and he's continuing with the treatment. And the reason was that in the last meeting I had with the doctor in end of June, I told him that I am feeling very happy. My quality of life has improved by leaps and bounds. And when I said this to him, my quality of life has improved, he said, okay, fine, continue with the medicine for some more time. Because he thinks that apparently, since I am really feeling positive and feeling very happy, and anxiety is pretty much under control, the medicine can be continued. Now, I'm deliberately at this point in time in this video, I'm not telling the name of the medicine because these medicines are prescribed medicines. These medicines are not supposed to be taken without the consultation and the advice of a doctor. So I'm not telling the name of the medicine because, if I tell the name, somebody may try it, which would be very much not the right thing to do. Because these medicines, especially of anxiety or related things like depression, these medicines do have an effect on the brain. Let's be very frank, that's what the effect is. Because if you get anxiety, if you get depression, there is something, I would not say wrong, but there is some, up and down sort of a thing in your brain. So that has to be set right, and the medicine tries to set it right, and the chemical imbalance or whatever which is there present in your brain gets balanced and you are feeling normal. So therefore those medicines need to be taken on the advice of the doctor. You cannot take it on your own, and therefore I would really not tell the name of the medicine. Now finally, I would also like to tell you one more thing, that in the last 1 year I have practiced meditation. I have practiced breathing exercises which are a part of yoga, and those also have helped me a lot. I have tried to deliberately, I'm repeating it, I have tried to deliberately try to cultivate doing things which I enjoy. Like my most favorite thing to do is reading books. So I've really tried to read as many as possible. I've bought a lot of books in the last 1 year, and I'm really stocking up the library and reading books. I'm very happy. I look at the books and I feel very happy. And I'm also indulging in one more activity which really is close to my heart, which I enjoy, is singing. And I've got an account on Star Maker app, and I'm singing a lot of songs, mostly Hindi songs, and I'm very happy. I've sung more than 790 songs of that song, which are quite a huge number considering in the last 7-8 months I've sung those songs. So I'm trying to do things which I enjoy, and since the anxiety has gone down a lot, I'm doing those things with a lot of passion and wholeheartedly. So my advice to every one of you finally is that if you feel anxiety, if you are getting anxious or depressed about anything, don't really suffer silently. Go to a doctor. Don't think that something is wrong with my brain, that I've gone mad, or really I'm losing control, or some mental imbalance I will have. Don't really get into all these things. Just like there could be some imbalance in your stomach, just like there could be some imbalance in any part of the body, it can also happen in the brain. And when that happens, you may feel low, you may feel anxious, you may feel depressed. So it's just that the balance has to be set right. There's nothing really to worry about. There are very good doctors, there are very good medicines available which will improve the quality of your life. And don't hesitate for a moment to approach a doctor, get yourself treated, and get out of this mess, because anxiety is really a very bad thing. It doesn't allow you to live a normal life. It can be destructive. It can affect your mental and physical health. As I explained in my last video, how the symptoms which I suffered, I lost 10 kgs of weight. I mean, this is not really done. This is a life which we have to live as happily as possible, and do not really delay, do not postpone, do not think that things will improve on its own. Yes, try alternate things, but if you're not able to really cope up with it, then consult a professional. You can win this battle, you can come out of this, and I want you to share your experiences with me regarding anxiety. And if you have got any questions, I will definitely try to answer, because I cannot really go on detailing all those things in the video with it. That will be very, very long. So I will answer the questions if you've got any queries regarding my own case. And please try to be positive, be happy, have faith in God, and of course, try doing things which you love, and consult a doctor if you think that you are not able to cope up with it in due course of time. So that's my final message in this video. So folks, be happy and take care.